represent the poorly represented. When you talk about the market solution, and I'm neither for it nor against it, when you talk about the market solution, you have lots of people who have no role in the marketplace, whatever. They're not represented. They are the poor, the vulnerable, those on the margins of society. Those people don't have a voice. And those who have self-interest are the ones who usually do most of the speaking. A religious perspective, each of the three religions, I believe, would talk about the vulnerability of the poor, of those who are unrepresented, and change the order of discussion. Of human rights was the principle of dignity. I happen to have been on the UNESCO's International Bioethics Committee, and a couple of years ago, we declared, remember now, these are people from all the nations that are signatory, no commonality of a religious structure, no commonality of metaphysics, no commonality necessarily of their commitment to health care, but all agreed that the first principle of bioethics was the dignity of the human person, what it is to be a human being. That particular notion is under attack today. Who stands for it? I think the major traditions do. That needs to be entered into the discussion. It can't be swept under the table and said, that's your private opinion. Do human beings have dignity or not? And answering that question has tremendous implications about how you design your policy. So what I'm saying here then is that you have a perspective that's very different from the straight political perspective. Nothing wrong with politics, but ethics ought to drive economics and politics, not the other way around. And that's where I think the difference comes. We can get lost easily in the economics we have. Question then, do we have a moral obligation? That second question. I think we do. I think a good society has an obligation to those within its group who cannot fulfill themselves because of their capacity is limited by health matters, by disease, limited severely by any variety of situations that affect their common life. So that we not only consider health in terms of bodily harm, but also in terms of not only the emotional, but in terms of the social situation. And if we were to look at a list of the commitments of the Catholic healthcare system, again, there'll be similarities, but let me get them on the record. The dignity of the human person I talked about, the respect for life, as you know, from the very, very beginning, is strong in our tradition. The equality of human persons, regardless of their origin or where or who they come from. That equality, again, would translate it when you're thinking about healthcare reform as a moral obligation now. So the way I'm thinking about it, before we talk about whether we can do it or whether we can pay for it, that comes secondarily. If you've made the decision, then you'll decide whether or not you can, and where you put it in the spectrum of other goods. It's not the only good in society. I wouldn't say that at all. That's why the common good embraces more than health, but it does embrace health. And when you're missing that element, you're missing an important part of what it is to be a human being. Natural law ethics, you heard.